My name is Nrp510. I'm a registered nurse, and today I'm going to teach you how to flush your PICC lines. I'm going to teach you what the signs and symptoms are if you have a PICC line that is clogged, and I'm going to teach you some ways to manage that and some resources to get help for it. Okay? So to start out, we're just going to explain what a PICC line is. I know most of you have family members or you have a PICC line yourself that you have to maintain. And what I have here is a little chart that shows exactly how PICC line goes into a vein all the way up and goes right into the tip of your heart. That's one of the reasons why it's really, really important to keep the flow. So you want to keep that from getting clogged, and you also want to keep it from collecting bacteria. Because when you don't flush it, little fibers get in there, and bacteria likes fibers, okay? So I'm going to show you a little film. It takes about 2 minutes just to explain to you a little bit about your PICC line. I'm sorry, I need to go backwards. Let's hope this works. I should have had that already. Sorry about that. Okay. Well, we won't look at that. We'll come back to that. All right. There's all different type of PICC lines. Some of them you'll see, they have 2 lumens. These are called lumens. These are the caps. Okay. Some of them you see have 2. For example, the one that we have here has 3. Also, the one that I have here have a little clamp on them that helps you close it and open. Okay? It doesn't matter if you have 2 or 3. Each of your lumens, when they're not in use, will need to be flushed. Okay? How do you know when you need to flush them? You're going to flush this anytime that you use it. If you go to the clinic, you get a procedure where you actually get fluids or medicine, you need to make sure that they flush it, okay? Some manufacturers want you to flush it every 12 hours. It just depends on what your manufacturer says, but keep in mind, the more that you can keep it flushed, as far as keeping the flow, the better off it's gonna be. Without this, you'll have to probably come in and get an IV put in, or you'll have to come in and get some other way to get your medication. This is easier than getting stuck all the time, right? Okay. Those are just some examples of what the caps look like. And if you all want to, you can look at one. Now you notice on that cap, on the very end of it, the top of it, is a little rubber stopper.
The needle?
That's where you're actually gonna put your syringe onto that, okay? And most of them now, places are going to the needleless, so you're not actually gonna put a needle there. What's actually gonna happen is this is going to screw into there.
Oh, wow.
Okay? Good. And I'm gonna give you a chance to try that out. So I'm just gonna let you take this and screw that in just to get used to it. Very good. One of the other things we're going to do now, one of the objectives, one of the things we want to get done is to teach you how to flush your PICC. So everybody should have a little pamphlet. And we're going to go through the steps, and I'm going to give you an opportunity to flush your PICC. Okay? I'm going to let you use this
one. Now open it.
Yeah, right. Okay, the first thing we got to do is going to turn to the page in step 1. But there's 4 steps. Step 1 is hand hygiene, okay? Anytime that you're gonna touch your pig, you're gonna be flushing it or manipulating it any type of way, you wanna make sure that you wash your hands. You can wash your hands with warm soap and water. If you don't have warm soap and water, you can always use hand sanitizer, okay? Next thing we do, we wanna gather our supplies, okay? The supplies that are gonna be needed is gonna be a 10 ml of normal saline, okay, and alcohol swabs, okay. And when you leave the hospital, or if you have a home health person, they should be supplying you with these. If they don't, always call back to the infusion center and we'll see what we can do as far as getting you some resources for that. So if everybody would just take just so we can get used to gathering our supplies. So we've washed our hands, right? We've got our supplies, and we're gonna go to step 3. Now we wanna make sure that the work area that we're working in is clean, okay? And the reason why I keep saying clean is because we don't wanna add any bacteria, okay? So you're gonna wash your work area or just wipe it down with either warm soap and water or antiseptic, and I've got some pictures there, like Lysol spray. And you're gonna place all your supplies on a clean towel. Now if you have to cough or sneeze, make sure you turn away, okay? So don't cough on your supplies. Now we're gonna actually flush the pit, okay? We've got our supplies, we've washed our hands. We're gonna wash our hands again, okay? And I keep saying to wash the hands because we don't want to add any bacteria. We're gonna wash our hands again. Next thing we're gonna do is go ahead and open up our alcohol swabs. And we're gonna take the injection site, which is that little rubber stopper, and we're gonna clean it, okay? So if you want to just take one and just practice cleaning it. And we're going to do it forcefully for 15 seconds. So you can sing a little song or whatever you need to do. ABC's made. There you go. For 15 seconds. And once we've done that, we're going to let it dry for about 15 seconds.